I'm Dr. Douglas Denham, Chief Medical Director here at Clinical Trials of Texas in San Antonio. Today I want to talk with you about hypertriglyceridemia or high triglycerides. So what are triglycerides? Triglycerides are one of the fats that we eat in our diet. They're useful for a number of things of making different molecules that our body needs to grow. The problem with high triglycerides is that it can cause a lot of different problems for your health. One of the leading problems that we see with people who have high triglycerides is pancreatitis, which is an inflammation or infection of the pancreas, and this can cause severe abdominal pain and discomfort that way, and also lead to other problems further on down the line, such as even diabetes if it's severely damaged. So how do you get high triglycerides? Well, sometimes people have a genetic predisposition to that. It travels in families, and they'll all have problems with triglycerides that can be as high as 500 up into the thousands. And again, they have problems associated with that. High triglycerides also come from a diet. If you're eating a diet that's high in fats, your body can have and doesn't process these high triglycerides well, or the triglycerides well, you can end up with an elevated high triglycerides. Also, alcohol use can lead to elevated triglycerides. And last but not least, poorly controlled diabetes is very often seen in people who have high triglycerides going on in their bodies. Treatment for high triglycerides is diet modification. Obviously, a low-fat diet is also essential for losing weight and just keeping us healthy. It also helps prevent you from developing atherosclerotic lesions or heart disease. High triglycerides are a leading cause of that. We see it especially in women who seem to have a higher predisposition to that. If you can't control it with diet, we have multiple medications. We have fish oil, which everybody can take over the counter, which does a pretty good job with that, along with eating a good, healthy diet. If you have problems still controlling your triglycerides, then we have different medications that are prescription. The fibrates probably being the most likely one. And then there's some other more specialized statins, Lipitor, Crestor also do a good job in controlling triglycerides as well as high cholesterol. So if you don't know about what your current cholesterol triglyceride levels are, you should probably go see your primary care physician and get a lab test done. If not, you can come here to Clinical Trials of Texas, and we do some triglyceride testing related to several studies that we're currently offering, which we can give you an idea then of what your status is. Again, if you have diabetes and you're not well controlled, that would be a concern, and certainly need to go get better control of your diabetes from your primary care doctor.